In this tutorial, I will be discussing the osteology of the thoracic wall and the functions of the thoracic cage. The thorax is the region of the body that we find inferior to the neck and superior to the abdomen. The superior aspect of the thoracic cavity is narrow, and as we descend downwards, it becomes much wider. So as I outline the thorax here, we can see that the widest part of the thorax is the inferior aspect, which I'm outlining right now, and the superior aspect of the thorax is the narrowest part. What we find inside the thorax are the primary organs of the respiratory and cardiovascular systems. These particular structures are located within 3 different regions within the thorax. The central compartment is referred to as the mediastinum, and within the mediastinum we will find the heart and the great vessels coming off of the heart, along with other structures such as the esophagus and the trachea. On either side of the mediastinum we have the pleural cavity. So here we have the right pleural cavity, which is where we'll find the right lung and its associated structures. And on the opposite side of the mediastinum we find the left pleural cavity, where we'll find the left lung and the associated structures. What I've done now is added on some of the structures that we find within the thoracic cavity. One of the major functions of the thoracic cage is to protect these structures. So on the left side here we can see the left lung, and situated in behind parts of the left lung we can see parts of the heart. So if I rotate it here we can see a little bit better view of the heart. Situated behind the heart here we have the trachea, and posterior to the trachea we also have the esophagus. So these are some of the important structures that we find within the thoracic cavity that the actual cage protects. And inferiorly we can see some of the abdominal content. So here is the liver, and the liver is also protected by the thoracic cage as well. In addition to protecting structures, the thoracic cage also serves as an attachment point for our upper limbs. So here we can see the clavicle, where the clavicle would attach directly to the sternum. This is the only functional attachment of the upper limb onto the axial skeleton. Another important function of the thoracic cage is to resist the negative internal pressures that are generated by the elastic recoil of the lungs and the inspiratory movements when we're breathing. And lastly, of course, like other structures or bony structures in our body, the thoracic cage serves as a major site for muscle attachment. So muscles that aren't only involved in moving the thorax, but also muscles that extend up into our head or that are located on our back or our upper limbs. The skeleton of the thoracic cage consists of 3 major parts. Anteriorly we have the sternum, laterally we have 12 pairs of ribs on either side, and posteriorly we have the thoracic vertebrae, the 12 thoracic vertebrae. The sternum is considered to be a flat bone, and if we look at it from a lateral view here we can see that it is really quite flat, and it consists of 3 major parts. So the superior part here is called the manubrium, the intermediate part is the body, and the inferior part is called the xiphoid process. On the manubrium, some of the important bony landmarks is the jugular notch, so this indentation here. There's also a clavicular notch on either side where the clavicles articulate, and the first rib also attaches onto the manubrium. The manubrium articulates with the body at the manubrosternal joint, and along the body we also have notches, which are where the costal cartilages articulate. The inferior aspect of the body articulates with the xiphoid process here at the xiphoid-sternal joint. As I mentioned before, we have 12 ribs on either side of the sternum, and the first 7 ribs are considered to be true ribs because they all have a direct attachment onto the sternum. So you can see here are the costal cartilages. This unhighlighted here. Here we can see these are the costal cartilages of these particular ribs, and each of them directly goes up and attaches either onto the body or onto the manubrium of the sternum. Ribs 8 to 10 are considered or classified as false ribs because they don't have their own costal cartilage going up towards the sternum. So all of these ribs piggyback up onto the costal cartilage of number 7, which I'm outlining right here. The last 2 ribs are floating ribs, and these are ribs 11 and 12. So if we just tilt this animation here, now we can see the floating ribs, and these are considered floating because they have no anterior attachment at all. The last part of the skeleton of the thoracic cage includes the thoracic vertebrae. And we've discussed the thoracic vertebrae in more detail in another tutorial. But just to briefly mention, we have 12 thoracic vertebrae. These 12 articulate with all 12 ribs on either side, and they form the posterior aspect of the thoracic cage. At the superior and inferior aspects of the thoracic cage, we find openings, and these are referred to as apertures. We'll take a closer look at the superior aperture first. The boundaries of the superior thoracic aperture consist of T1, which I'll highlight here. Laterally, we find the first rib and also the costal cartilage of the first rib. So here's rib number 1, and here's the costal cartilage of rib 1. So laterally on either side, we find rib 1 and the costal cartilage of rib 1 forming the lateral boundary. And bounding it anteriorly is the superior border of the manubrium. Many structures pass through this particular opening, structures that are en route or passing down into the thoracic cage, and also structures that are emerging from the thoracic cage out towards the neck or the upper limb. When this particular anatomical region is discussed clinically, it's referred to as the thoracic outlet. And the reason that is because they're emphasizing structures that are emerging out of the thorax. So for example, the arteries coming out or coming off of the heart, and also the spinal nerve, T1. The inferior thoracic aperture is much larger than the superior thoracic aperture. Posteriorly, it's bounded by T12, which I'll outline here. Posterior laterally, it's bounded by the floating ribs, ribs number 12 and also ribs number 11. And the anterior lateral boundary is formed by the costal cartilages of ribs number 7 all the way down to 10. And we call this particular area the costal margin. Anteriorly, we have the xiphi-sternal joint forming its boundary. And then if I just go back down, here we have the costal margin again, which is formed by the costal cartilages of ribs 7 to 10. And posterior laterally, we have the ribs 11 and 12. I've now added on the respiratory diaphragm, and what we can see here is that the respiratory diaphragm attaches onto the bony markings and also the cartilages which outline the inferior thoracic aperture. And what it does is it creates a partition or a separation between the thoracic cavity and the abdominal pelvic cavity, which is below. In the next tutorial, we'll focus on other muscles which attach onto the bony thorax.